Hello everyone, today I am going to tell you in brief about the endotracheal intubation. What are the equipments will be required for the intubation? We need the laryngoscope with extra bulbs, a straight blade of all sizes, ET of various sizes. So, what are the various sizes of the laryngoscope blades we will need during NR? For extremely premature baby or less than 1 kg, double zero size of the blade should be there. If preterm 1 to 2 kg, then 0 size. If full term more than 2 kg, then one size of the blade will be required. Now what are the size of the endotracheal tube will be needed? Below 1 kg or below 28 gestation age, 2.5 internal diameter ET tube. 1 to 2 kg or 28 to 34 week gestation age, 3 mm size. Between 2 to 3 kg or 34 to 38 week gestation, 3.5 size. More than 3 kg, more than 38 week, 3.5 or 4 mm size of the ET. Now in this video you can see the procedure of intubation in left hand laryngoscope and in right hand ET. So always we should hold the laryngoscope in left hand. Then we have to insert the blade into the right side of the baby mouth. Advance the blade until the tip lies just beyond the base of the tongue in vallecula. Then lift the laryngoscope in the direction that handle is pointed. Do not rotate or rock the laryngoscope handle. Then you have to identify the inverted V-shaped vocal cord. Hold the ET in your right hand and insert into the right side of baby's mouth. Advance the tube until the vocal cord are positioned at the vocal cord guideline. So in this video you can see how to intubate. So first position the baby in sniffing dog. Hold the laryngoscope in left hand and insert, and then see the structure, lift the tongue, then see the vallecula. Now I am giving the cricoid pressure. If vocal cords are not visible, then give the cricoid pressure. Then insert the ET by holding in right hand. Then once you have inserted the ET properly, then against the upper lips you should hold the ET and then give the tube and bag ventilation. So I am connecting the ambu bag to the connector and giving the breathe. Breathe 2-3. Breathe 2-3. So this is the way to insert the endotracheal tube. Now how much depth of ET tube should be inserted? So the depth of ET tube should be weight plus 6. So if the 1 kg weight baby, then 7 centimeter, 2 kg, then 8 centimeter, 3 kg, then 9 centimeter. Or just you have to multiply the ET size with 3. So if you have choose the 3 mm size ET, then 3 into 3, 9 centimeter. Or there is a rule of 7. For less than 1, 2 and 3 kg, ET tube 7, 8, 9 centimeter should be inserted respectively. Generally remember the weight plus 6. It is the easiest way to remember how much depth you have to insert. This table again showing how much depth we have to insert. For less than 750, 6, for 1, 7, for 2, 8, for 3, 9 and for 4 kg, 10 centimeter. Now you can see how to fix the ET. We should cut the adhesive into two parts. Just leave the 1 centimeter stem. When you are removing the laryngoscope, fix the ET against the upper lip by holding it against the upper lip. Stem should be at the corner of mouth around the ET, and one part should be attached over the lip and another part should be around the endotracheal tube. So this is the way to fix the endotracheal tube. How to confirm the position of ET? ET is passed in the trachea or in the esophagus. First is when you have inserted the ET, you have watched that tube passing between the codes. Also see the chest movements are there or not. Listen for the breath sound in axilla and in stomach. If breath sound is audible only in axilla, not in stomach, that means you have inserted rightly in trachea. If breath sounds are not audible in the axilla, only in the stomach, that means you have wrongly inserted in esophagus. If improvement in heart rate and SpO2 after giving the tube and bag ventilation, that means ET is properly inserted in the trachea. Also vapor condensing inside the tube. When baby will exhale, CO2 will be condensed, so it will be visible. If you are having the colorimeter or capnography, then you can also confirm the position of ET. So in this image, you can see the colorimeter. This is the purple color. Once the baby will exhale, this will be converted into the yellow color. So two most important indicator that the ET has been inserted in the trachea is first is exhale CO2, which is detected by either colorimeter or capnography, and second is rapidly increasing heart rate, clinical sign which suggests that ET is properly inserted.